Welcome to the Mindful Return podcast. I'm Kelly Tuttle, a retired neurology nurse practitioner and brain injury survivor. Together, we'll explore practical tools and real stories to help you rebuild focus, confidence, and a meaningful life after a brain injury. Hey, and welcome back. Today in this episode, I'm going to talk about brain injury specialists. When I had my concussion, I thought I needed to see a neurologist. And when I did finally see a neurologist, which was about 6 months after my brain injury, it was great to get the confirmation that I had a traumatic brain injury. And it kind of made me feel like it gave me a direction on how to research how to get better. But I left the appointment disappointed, and I'm sure there are others out there who have had kind of this experience where my neurologist told me that basically my deficits would be permanent and there wasn't much that could be done. And he also didn't recommend any follow-up, any treatment, didn't refer me to anybody, didn't explain why I had the symptoms, and then didn't do any follow-up afterwards. What I've heard from other brain injury survivors is that they spend a lot of time, money, and energy knocking on the wrong doors, looking for care. And that's the key thing, is that you need to be taking your issues, your brain injury challenges, to the right specialist to get the right help and therapies for that specific reason. Everyone's brain injury and their symptoms are different, and you need to get to know your brain injury, your symptoms, and what your brain is struggling with so that you can better explain that to your doctor so they can refer you to the appropriate specialist. But, again, I'm going to talk about some of those specialists here in this podcast. The list is not exhaustive. So if anybody has any other recommendations or specialists they found helpful, please put that down in the comments below. So one myth is that that you should see a neurologist after a brain injury. And that is a myth we're going to talk about a little bit later on. And the other one is that all doctors are knowledgeable about brain injury care. And this is not true either. We're going to talk more about it. If you want to go into more detail about myths busting about brain injuries, check out my episode number 2 where I debunk traumatic brain injury myths. But for this episode, the brain is a complicated organ. And with that, that means that there are various aspects that it does for us and functions. And in the medical community and brain injury care space, there are multiple doctors and therapists that can help brain injury survivors. You're basically going to be seeing a team of people to help put together the pieces of the puzzle, of the whole puzzle of your and this is when when you see multiple specialists, it's really important to have your brain injury symptoms that you want addressed written down and in front of you, so it's easy to access and explain to your therapist or your specialist. So remember to journal your brain injury symptoms, write if they are getting better, if they're getting worse, if anything makes them worse, like light or sound exposure, anything makes them better, being in a darkened room, that kind of thing. Carry that information, have it written in your journal, and take it to your appointments so that you can quickly and concisely describe what is going on with you and your brain and advocate for the best appointment that you can have that day with that provider. So the first person you should see after a brain injury or a concussion, a blow to the head, or a motor vehicle accident or fall is the emergency doctor or an urgent care, depending on situation. If you think you're fine and it's mild, you can make the decision to then follow up with your general practitioner. Now, when you're seen in the emergency room or the urgent care, make sure you do follow up with your primary care doctor within a day or two after that visit. Some doctors work in a network where there's a communication that a patient's been in the emergency room, but a lot of times there isn't that communication, and you're going to need to facilitate that yourself and follow up with your doctor. And then once you see your general practitioner, they will do a history of what happened to you. They should do a neuro exam, and then they should also be screening you for any autonomic symptoms. And then they should follow up with you in 2 to 3 weeks, because if you're not better in 2 to 3 weeks, that's when you should start being referred out to specialists. One of the first specialists you should probably see is a physical medicine and rehab doctor, PMR doctor, also known as a physiatrist. They specialize in brain injuries and spinal injuries. So these are the people you really want to see, as opposed to the neurologist. So neurologists are trained in taking care of brain diseases like Parkinson's, multiple sclerosis, epilepsy. Now a neurologist can help you after a brain injury if you have ongoing headaches that your primary care provider hasn't been able to help you control. Some of them are headache specialists, or they oversee a headache specialty type clinic. So that's kind of where neurology comes into play. The other thing is, if you have a history of epilepsy or you develop epilepsy after your head injury, then the neurologist is who you will see to help manage your seizures. Another specialist is a speech therapist. And my patients used to get really confused when I would recommend that they see a speech therapist, because they would say, oh, I talk just fine. Well, after a brain injury, common symptoms are difficulty with speech, finding your words, slurring your words, blending your words, difficulty with spelling, but they also help with cognitive functioning. And they can do tests and find out where the deficits in your higher executive functions of your brain that are not processing right. And then once they have those identified, they can provide you with compensatory tools such as use of a calendar or list or other things that they will recommend to help you improve the performance of your brain and support its healing. So they are really key too. They're fantastic specialists. So definitely see them if your doctor recommends, and follow all of their recommendations and therapies and practice. Just because you're what I want to say briefly is a little bit of a tangent, is that just because your visits with your therapist, your speech therapist, you don't want to stop the exercises that they recommend. You want to continue them at the frequency that they recommend to continue to support the healing and rebuilding of new connections in your brain. And then if necessary, down the road, this is a huge tangent, sorry, but you would want to build upon those therapies to continue, because once the exercise becomes easy, you want to challenge the brain, and that encourages it plasticity and the rewiring of the brain and so forth. The next specialist is a physical therapist. Now, a physical therapist will help you with any injuries that you also obtained with your concussion, whether that is like whiplash, a shoulder dislocation, a fractured ankle. You need to see them and do their exercises, because once you start healing and recovering, you need help with building the connections between the brain and your body. And so if you have a neck injury, it's important to address the neck injury just as much as your brain injury, because the two communicate where your head is in space. So the physical therapist is going to help you with that. They're going to also help you with pain control and things like that. So please follow their recommendations. And then there's neurotherapists. And these therapists specialize in central nervous system injuries and issues. And they help with balance, eye tracking and processing, and treating vertigo. So you may see this specialist. Another Referral may be to an occupational therapist, and they help with tasks, normal everyday tasks at your home to help you do them and to encourage more independence. But they can also help you if you're at work and having certain difficulties with tasks. I would definitely get a referral to them and get their input on how to better manage your brain injury symptoms while at work. For vision, you've heard of optometrists. They're the people who help you with your eyeglass prescription, and they look to see if your vision is clear. So if you're having issues with blurred vision, then you want to see the optometrist to make sure your prescription is working for you. But if you go and they tell you everything is normal, you see 20/20, don't be discouraged, because they're just looking at how clear your vision is. They're not looking at how well your eyes are working together to clear up the picture that it's supposed to be processing to the brain. If you have double vision, and of course an injury to the eye that involves the eye, you'll be referred to an ophthalmologist. And if you have double vision, they can help you with a prescription for prism glasses to help correct that. And a fantastic specialist I was able to see during my recovery is a behavioral optometrist. And they are really great. They specialize in brain injuries, and they look to see how well the eyes are working together and how well your brain is processing what it is seeing. And they can look to see if you need therapies to help reconnect those lost connections or improve the processes that were knocked offline after your injury. But they also can diagnose you with what's also known as binocular vision dysfunction, and that's when your vision is off just a little bit, but it's enough to cause symptoms of anxiety, light sensitivity, headaches, neck pain because you're tilting your head to correct your vision. So an behavioral optometrist is really important to see, and I do recommend having your vision checked before you start going back to work, especially if you're having issues of difficulty with screen tolerance and reading and headaches and so forth. If you have issues with your hearing, you'll want to see an audiologist. They can screen you for sound sensitivity and talk about therapies and tools to help manage that while you're at work. They may give you what is known as a modified CAFA hyperacusis questionnaire to screen for the sound sensitivity. If they don't, you can look on the internet for that screening tool and fill it out and take it in to your appointment. And there's another test they can do. It's called a loudness discomfort level. And again, that's a tool to kind of measure how sensitive you are to sounds. And you may also need a referral to see an ears, nose, and throat doctor. This is if you're having vertigo, gait difficulty, balance issues. One of the things they can look is to see if you have what is called superior semicircular canal dehiscence. This is when your head injury causes a breach in the overlying bone that's to cover the superior semicanal to protect it from external sounds and pressures. And this is a little tidbit that can happen to people after a brain injury, and they have persistent difficulty with balance and walking and just really no tolerance for sounds and so forth. So as this kind of a misdiagnosis, so if you have these symptoms and they persist, then you may want to ask to be screened for that. And it's really easy. It's just a head CT, and they just have to have the radiologist look at that specific area of your brain. Another really good resource is seeing a psychiatrist. A psychiatrist is a medical doctor that can treat mental health issues brought on or worsened by a brain injury. They can address behavioral issues such as bursts of anger or impulsivity, and they can help with sleep difficulties that aren't responding to kind of first line treatment. So if you see your primary care provider and you guys try a bunch of things, to help you sleep and nothing's working out, then ask for a referral to a psychiatrist because they can write prescriptions for medications for those issues. Another person you may want that you may ask to be referred to is a neuropsychologist. They're great with helping you with mood management, mental health conditions, and they can diagnose you with post-traumatic stress disorder. They're the specialists you'll want to see if you think that's what's going on, which is kind of expected because usually it's, with a traumatic brain injury, something traumatic has happened to you and you may need help with that. And the other thing that the neuropsychologist can do is provide you with a neuropsychological assessment test. And this is a test that will that looks at like your cognitive deficits, just the functioning of your brain, your personality, and all sorts of information could be helpful in guiding your care, getting back to work. So that it can be a really key test or a screening to get done. Unfortunately, the testing is extensive and it can go over a day or two. I mean, an entire day, like 8 hours plus to get the test done. Sometimes they'll split it into 2 appointments just because of the neuro fatigue that kind of comes along with the testing. And the other thing is that some insurance companies won't cover it. And so you may have to pay out of pocket to have the test, but it is a really helpful test to get done. Another person to see while recovering from brain injury to consider is a counselor or a talk therapist. They're great because they can help you with what's known as cognitive behavioral therapy, and that helps you cope or deal or address, those negative thoughts and ruminating thoughts you might have in your head. So they can definitely help you with that, and they treat anxiety, help you manage your symptoms of anxiety or depression. They can also help you with your mindful practice. They'll recommend mindfulness, but if you're having difficulty engaging in mindfulness, they are the specialists to ask for to help you with that. And they also can help you navigate the process of grieving, which can happen after a brain injury because of the changes in your brain function and maybe your role with your family and your work. And then just since I'm talking about counselors, I'd like to mention family counseling. So if you're having changes in your roles, like you were the income earner and now you're unable to go to work full time, so you and your partner are going to switch roles and you're going to become the home manager. So a family counselor can help you with those role changes. You can involve the children because brain injury just doesn't only impact you, the survivor, but it has a ripple effect out to those who surround you and love you. And they can also help you with parenting. So after a brain injury, some survivors aren't going to have the capacity or the tolerance to, say, be the initiating parent for discipline or addressing a behavior with your children. And maybe it's better that the caregiver, the brain injury survivor, does the initial, interaction, creates a safe space, and then sets time aside to discuss the issue with the kids. And then maybe the brain injury survivor can come in at that time when things have quieted down and settled, allowing them to better utilize their cognitive skills and communication skills. And if you have symptoms that persist, such as the neural fatigue, headaches, dizziness, and changes in weight, you may want to consider getting a referral to a neuroendocrinologist. Sometimes after a brain injury, there can be changes in the pituitary functioning, and this can lead to hormone deficiencies, and they can help screen you for those issues. Sleep doctor is somebody who can screen you for sleep apnea. Sleep apnea, it can happen after a brain injury. If you're having difficulty with that fatigue or difficulty with sleep, then get screened for sleep apnea, even if you think it's going to be negative, then that's more helpful information for your doctor and anybody else that you're seeing for your sleep issues. And then there's also sleep coaches that you can find that can help you with your sleep, because sometimes sleep is, when it comes down to it, sleep most of the time is learned behavior. It's best treated with sleep hygiene techniques and doing things that help support the brain to transition from daytime to nighttime. And a sleep coach can help you with that. Now, I have seen that there are also concussion clinics out there. I've never been referred to a concussion clinic at my insurance. It was only for athletes, so I couldn't get a referral. My insurance didn't cover, so I'm not sure. You'd have to check to see if your insurance would cover a concussion clinic or concussion care clinic. And then it also depends on where you live. Is there one in your area? All I can tell you is that I've heard about them. I can't tell you a whole lot about them. I haven't had the experience of going to one, but look into that. Ask about that. See if that's in your area or if your insurance company covers it, because that would be great if you could go to a clinic and get help too. So that's a lot of information I just shared on some of those specialists. I know there's more probably out there. So just keep asking, be persistent about explaining your symptoms, and keep your providers and your specialists informed on your progress so that they can make the decision if they need to make a different referral or they need to change up your therapy to make it more challenging. Anyway, I hope this is helpful. Take care, get better, get stronger, and I'll see you in the next episode. You've been listening to the Mindful Return podcast with me, Kelly Tuttle. Subscribe wherever you listen and head to kellytuttle.org for brain injury recovery tools, free resources, and inspiration to help you return to work with confidence and hope.